I'll just go ahead and start. So my name is Dr. Alvaro Huerta. Oh, yeah. So as people join, if you could just help, Justin, help us with the muting. So I'm Dr. Alvaro Huerta. I'm an associate professor here at Cal Poly Pomona, a wonderful university where we have horses and pumpkins and beautiful, diverse group of students and faculty and staff. I'm also a fellow at the Harvard Divinity School. So I'm very excited today to introduce Dr. Rosalind A. Vega. She's an associate professor at the University of Texas, Rio Hondo Valley. She's also the director of medical humanities, and she's at the Department of Anthropology. So before we turn the mic over to her, I just want to thank everybody, including the kids that are yelling right here. Thank everybody at the library, wonderful people. I think that the librarians are the best people in the world in terms of always wanting to help us with our research. So thanking the dean, the librarians, and the staff for helping put together these wonderful events where we're learning from these top-notch scholars in the world about different fields that have to do with social justice, racial justice, health, economics, urban planning, ethnic studies, a wide variety of topics that we're going over this fall. Last week, we were able to view a brilliant artist, my brother, Salomon Huerta. And today we're gonna have the pleasure of learning from Dr. Vega. So everybody do a virtual applause here. So go ahead and take it away, Dr. Vega.
Thank you so much for the lovely introduction. I'm going to share my PowerPoint here and just nod that you can see it. Wonderful. Okay. So my presentation is called Functional Medicine in the Age of Black Lives Matter and the COVID-19 Pandemic. At the get-go, I just need to explain, what is functional medicine? Functional medicine is a model that has been shown to produce better outcomes than conventional medicine in a 2019 study published in the Journal of American Medical Association. Functional medicine is a personalized and a holistic approach to treating chronic disease. It is both an alternative to and an outgrowth of conventional medicine. Many functional medicine doctors are conventionally trained. These doctors turn to functional medicine after becoming frustrated with a healthcare system that pharmaceuticalizes health problems instead of seeking to create lasting health. Thus, functional medicine presents a series of paradigm shifts to conventional medicine. One primary paradigm shift is the switch from a body as machine model to a systems biology approach. Functional medicine uses systems biology to identify root causes and ultimately promote healing and recovery. This involves exploring patients' biochemical individuality and may incorporate tools such as gut microbiome testing and genomic profiling. All right, so let's see. That's not what I wanted to do. I wanted to do the slideshow. Okay, so this is an image from Blue Cross Blue Shield showing a health index by age 17, but the data is similar. And so it demonstrates a major decline in health that begins around age 27. You can see right there that there's that dip. I'm not sure of the average age of the people in the audience, but it's haunting to think that in your mid-20s is when a major health decline begins. This is a graphic from the CDC, and it's demonstrating chronic diseases in America. So 6 in 10 adults in the US have a chronic disease, and 4 in 10 have 2 or more. We're talking half of the individuals in the United States or more than half, are dealing with these diseases that can lead to disability, things such as heart disease, cancer, chronic lung disease, stroke, Alzheimer's, diabetes, and chronic kidney disease. I'm sure that people in the audience are aware of this in their community, perhaps in their families and among their friends. This graphic is a critique of the pharmaceuticalization of medicine. And it's demonstrating how for the shaded individuals, those are the individuals for whom these 10 highest grossing drugs in the United States help. Whereas the others, the white little heads, are those that it actually fails to help. And so even though these are the top 10 highest grossing drugs, they don't tend to help people improve over time. I need to explain to the audience what epigenetics is in order to explain the role of functional medicine and how it is unique and different from conventional medicine. So this is a image that was taken from a study where these genetically identical mice were exposed to different things over the course of their life. Specifically, they were testing BPA. And so one mice had this exposure and the other mice did not. However, they're genetically identical. So the phenotypic difference that you're observing emerged not pre-conception, not in the embryonic phase or prior to conception, but while these mice were in the world living their lives. And this shows that our diet, our lifestyle, our exercise can actually have this physiological change on our genome. The way that functional medicine interlocutors describe it is like light switches, where you have these switches on your genome that can either be turned on or turned off, depending on your environmental exposures. And so this really kind of is a post-genomic perspective that changes our understanding of the genome as something that's fixed, and instead making it something that's malleable. There's also a lot of study that's going on more recently on how individuals can adjust their biological age. Age, biologically speaking, is often measured by a telomere length. Telomeres are little caplets, kind of like the little caplets on the end of shoelaces, and they protect your DNA. And as they wear down, you are biologically aging. So the length of those little caplets that are protecting your DNA, I'm using this shoelace analogy, is indicative of your biological age. The longer that it is, the younger you are. The shorter it is, the older you are. And so recent studies have been able to use diet and nutraceuticals, other things like meditation and other lifestyle factors to actually reverse the aging process and show that people are able to become, biologically younger. A study that was recently conducted by a functional medicine group showed, I think it was an average about 3 years younger within a year. And that's actually pretty astonishing, given that the people were actually aging during that year. And also given that they had selected for people that were already healthy. So they didn't have as far to go as perhaps people who were ill and then recovered and may have even benefited more from this protocol. I also need to talk a little bit about the microbiome, because people in the audience may not be totally familiar with what the microbiome is. And to do that, I need to kind of expel the myth that certain parts of our body are sterile and that bacteria are bad and that they're germs, right? Now, certain bacteria are pathogenic and can be harmful to our health. However, we are 100 times more bacterial than human, in the sense that the bacterial DNA in our body greatly outnumber our human DNA. We are comprised of bacteria, protozoa, fungi, yeast, so many different types of microbes that those things, including viruses and retroviruses that have become a part of our DNA, actually outnumber what is uniquely human DNA. So this is a scan of the brain, and that area that's circled in red, those are bacteria that are in the brain. And we used to think of the brain as sterile. We thought of the womb as sterile. None of these things are true. We are filled with bacteria everywhere, and the bacteria play a role in a lot of our thought processes as well, since they are producers of serotonin, they are producers of other types of neurotransmitters. And so now there's this emerging field called psychobiotics, where you can take certain types of, you can think of them as probiotics, but that they have an effect on how your body produces these neurotransmitters and on your mood and on your thought processes. So the number of studies per year that have been published using the search term microbiome has really just, jetted and exploded in the last years. This is an emerging field. Functional medicine looks at what is called the omics: genomics, transcriptomics, proteomics, and metabolomics. So it's when you see that suffix omics, you should think the sum total of the genome, the sum total of how RNA is transcribed, the subtotal of those proteins that are created, and the sum total of all the metabolic processes that are occurring in your body at any one given moment. And the aim of functional medicine using advanced testing is to understand all of this about the bio-individual. So there's no longer a one-to-one relationship between you have this disease, then you need this drug, because they are really honing in using these personalized tools, what they call personalized medicine, to predict what might happen to a person, to interpolate them so that they participate in their own healthcare journey, and really just personalizing care based on the genome, the metabolome, so on and so forth. So as you can see, they're really looking towards that most personalized peak, which means a lot more data to offer personalized nutrition science and data. So this is a little bit about my methods. I participated in 60 hours of coursework in nutrigenetics and nutrigenomics. I'm an anthropologist, so you're going to see that this is a digital ethnography. I also subscribe to 29 functional medicine interlocutors newsletters. I completed 27 continuing medical education credits. I also read a number of books intended for a wide audience. I tend not to, I have read, but I tend not to cite as often peer-reviewed, I don't like this term, but hard science literature that has been published by these same authors, instead opting for things that have been, New York Times bestsellers, because I'm interested in the social life. I'm interested in discourse and how it is emerging in the public imaginary, how people are coming to understand these concepts. Also, I won't read every single thing here, but webinars, e-courses, masterclasses, summits and conferences, YouTube channels, Facebook groups. The Facebook groups that I was in totaled almost 250,000 patients, docuseries, podcasts, blogs, magazines, newspapers, online health platforms. This is a social network map. I'm not sure if you are all familiar with this, but it's including the people who are public figures, who appear, in these YouTube videos and in these online summits, and the connections among them. And so I'm able to demonstrate kind of visually that this is a cohesive community. I was once asked by someone if what I was observing was just kind of people that I happened to encounter, or if really functional medicine is a cohesive community. And this graphic is demonstrating that cohesion visually. This is another social network map, but it's based on the different sources. So a specific podcast or a specific webinar, and how people who were in one podcast may also have been in that other webinar, and how those paths cross. So this is a source-centric visualization of the same thing. In case you're wondering about the types of people that I observed, the largest number of people were medical doctors, followed by health and science doctorates or PhDs. And then there were a number of other allied health professionals and others who participated or who I became aware of while doing my participant observation. How does this research challenge existing notions of ethnography? Well, let me go over here. How are we doing on time?
We're at, you have about 25 minutes or 20 minutes.
Okay, so I think that I'm going to, okay. So how does this challenge existing notions of ethnography? Well, part of my ethnographic data was gleaned through standard in-person participant observation. So if you are an anthropologist or you're familiar with anthropology, then this is the ethnography that you're used to. But the majority of my data is pulled from online spaces, those spaces that I've already mentioned, where functional medicine discourse unfolds. In addition to digital ethnography, this research incorporates my personal experiences as someone who has struggled with and recovered from chronic disease. Autoethnography appears, and I say in the manuscript, I want to do a little side note here, because this talk is actually pulled from 2 books that I am working on. One is already in press and will be available in the spring from UT Press. And the other is under review, also with UT Press. And so there are actually 2 manuscripts, and they appear in the form of interludes between chapters, thus demonstrating what is at stake for individual patients in the chapters that follow. By including my experiences in this way, I argue for the destigmatization of disease. I also enact hyper self-reflexivity. Now I'm going to pause on self-reflexivity for a second, because one of my major critiques of functional medicine is how it fails to really be inclusive. And I'm going to dive into that deeper in the upcoming slides. But when I critique that lack of inclusivity, and I talk especially about the privilege of functional medicine practitioners and of their patients, I'm enacting this hyper self-reflexivity and kind of turning lens upon myself and acknowledging my own privilege as someone who was able to afford this and someone who was able to benefit from it, and really reflect on what would happen if that were not the case. And so I write in distinct registers as a medical anthropologist and also as someone who reversed longstanding illness. This is another visualization. This is me at my kitchen table, sitting down, trying to understand my own biology and how all of the different things, the different illnesses I was dealing with were connected. So this is a visualization of systems biology, which is, I mentioned at the very beginning of the presentation, how functional medicine shifts us away from that body as machine kind of isolated parts, where you go to a gastroenterologist for the digestion, but you go to a dermatologist for your skin issues, and you see all these different specialists, but really there isn't this more global perspective on how everything in the body is connected. And so this was my understanding my own systems biology. All right, so as I was saying, I'm diving into that my critique of functional medicine and privilege. During my ethnographic research, functional medicine was delivered predominantly by white providers to mostly white and socioeconomically privileged patients who pay for services out of pocket. Functional medicine's emphasis on bioindividuality places the responsibility for healing on the individual, and often sidesteps important issues of racial and socioeconomic inequality. Prior to May 2020, the functional medicine community largely fell silent on issues related to inequality, thus failing to interrogate the underlying logics that reproduced social and racial health disparities. When inequality was mentioned by well-meaning interlocutors, the discussion was often inadequate and incomplete. The year 2020 marked a massive shift in functional medicine discourse, largely due to the resurgence of the Black Lives Matter movement and the COVID-19 pandemic. The Institute for Functional Medicine CEO, Amy R. Mack, described COVID-19 and Black Lives Matter as two cataclysmic events that propelled IFM's thinking forward. She indicated that while flaws in healthcare have been apparent for decades and changes long overdue, inequities to access were amplified in the context of COVID-19. This is a quote: "The system is irrevocably broken, and in today's environment, the cracks and fissures are bigger than ever." She argued that it is time to be bold and take decisive action to ensure that health is not determined by one zip code, accumulation of wealth, or skin color. Dr. Mack indicated that for the first time, disparities between health, wealth, and race will inform the work of the IFM. As in conventional medicine circles, functional medicine practitioners turned their attention to the physiological underpinnings of COVID-19. However, they framed the pandemic as a call to focus on the social determinants of disease and what they called the public health crisis of racism that disparate COVID-19 outcomes quickly laid bare. Dr. Mack explained that people of color are less likely to receive preventive health services and more likely to experience poor quality medical care when compared to whites, thus resulting in a higher level of chronic disease burden beginning at a younger age. She wrote, "In medicine, racial and economic differences determine both the quality and the type of healthcare an individual receives, and the disparities in health outcomes between whites and people of color are exceedingly stark." Pointing to the effects of intersectionality, she indicated that impoverished adults experience poor health at a rate that is multiple times higher than privileged counterparts. Dr. Mack emphasized that racial and economic inequality in healthcare is true in conventional medicine and functional medicine and beyond, and asserted it's true and it is unacceptable. I agree. All right. Let's see. As a community, functional medicine interlocutors began pointing to what Dr. Bland termed a pandemic within a pandemic. Dr. Prescott referred to COVID-19 as a lifestyle disease and pointed that the spread of the disease is linked to social inequality and poverty. Dr. Bland similarly pointed to the sociobiological interrelationship between COVID-19 virus and the social, political, and economic factors shaping its spread. Dr. Mack went on to explain higher rates of infection among minorities when she explained that these populations disproportionately make up essential workers in the United States. Dr. Mack noted that essential workers, grocery store and restaurant staff, healthcare practitioners, delivery drivers, factory and farm workers cannot distance themselves from the public and therefore risk themselves and their families to protect and bring comfort to others. Meanwhile, essential workers are often among the most susceptible to COVID-19 because they are also facing chronic disease. So this is an image that piece of artwork that was created by Dr. Prescott, who is a functional medicine practitioner, and she showed it at the IFM Annual International Conference in 2020, and it is demonstrating a profound ecological imbalance in society, which is inequality. And she's also talking about kind of systemic issues that perpetuate inequalities. Okay, so right there she says NCDs, which is that the burden of non-communicable diseases in the long term. And something that's kind of interesting among functional medicine practitioners is how they think of chronic diseases as, quote, infectious or communicable because they're caused by social issues. And therefore, you see them in communities, you see them in families, you see them in friend groups. And even though they're not maybe biologically communicable, how would it shape public health action if we thought of these things as communicable? All right, Dr. Fitzgerald notes reported COVID-19 outcome disparities, including hospitalization and mortality rates among multiple Black, Asian, and minority ethnic groups. This situation is an example of what Sherelle Barber calls death by racism. However, death by racism is certainly not unique to the COVID-19 pandemic. Kaya Perot emphasized, Black, Indigenous, and people of color are far more likely to get sick and die from the 10 leading causes of death due to a range of factors. Among these are a lack of access and the cascading effects of racism, prejudice, stereotyping, and unconscious bias on minority health. Thus, pre-existing chronic conditions among people of color, combined with long-standing racial discrimination, make them more vulnerable to the COVID virus. Dr. Bush clarified that in the United States, it emerged as an epicenter of the COVID-19 pandemic, not because of a higher concentration of germs, but rather because of widespread problems among the American population with innate immune function. According to the CDC, 94% of all COVID deaths occurred in those with at least one comorbidity, meaning the person already had a chronic disease. Dr. Bush asserted they are not dying of COVID, they are dying of their comorbidities. Dr. Fitzgerald clarified, comorbidities including diabetes, hypertension, and obesity are associated with much worse COVID outcome. And in the US, Black people are far more likely to suffer with these comorbidities, and thus COVID mortality rates are higher with people of color. These perspectives have led me to ask, what would happen if society treated chronic diseases as if they were epidemics? For example, the obesity epidemic and the diabetes epidemic. At the same time as race-based disparities in COVID outcomes sparked conversations among functional medicine interlocutors about racial injustice, the brutal killing of George Floyd emphasized the dire need for action. In June 2020, Dr. Fitzgerald indicated, functional medicine is not yet adequately addressing the profound racial disparity in medicine. Dr. Fitzgerald prefaced Dr. Mack's comments, which appeared less than a week later. For certain, those who need functional medicine the most are not receiving this care. Functional medicine practitioners agree that while racial disparities exist in both functional and conventional medicine, functional medicine is best positioned to address the disparate outcomes of COVID-19 and chronic disease. From this perspective, ongoing racial disparities signal that functional medicine has not yet lived up to its potential. Dr. Sophia McCarter, a Black practitioner, reiterated Dr. Mack's descriptions of racism as a public health crisis and COVID-19 shining a bright light on health disparities and their relationship to quality health care. However, she incorporated the medical anthropology concept of a syndemic and argued that comorbidities that make people more susceptible to COVID-19 are best addressed by functional medicine. Dr. McCarter went on to describe sociologist and civil rights activist W.E. Du Bois' critique of scientific racism and asked her colleagues to follow his lead by naming racism in the natural health sciences. Dr. McCarter applied these intersecting anthropological arguments to the COVID-19 pandemic when she opined that the pandemic is an opportunity for facing racism head on and is dependent for healthcare professionals learning how to ask. A July 10, 2020 Whole Health George Washington University newsletter titled Integrative Medicine, COVID-19 and Health Equity reiterated that while racial and ethnic minorities have experienced health inequalities for decades, the novel coronavirus has demonstrated the extent to which this is the case. The newsletter advertised the Health Equity series designed by Dr. Miranda Ward. The series defined health equity and outlined contemporary challenges, explained social determinants of health, recognized vulnerable and socially disadvantaged US populations, and argued for cultural humility during difficult discussions. Just one example of functional med interlocutors are beginning to address the urgent need among healthcare providers for education and training to ensure that they understand the patient's health problems in a wider context. And there I want you to read the social determinants of health. In essence, functional medicine interlocutors see the COVID-19 pandemic and the Black Lives Matter movement as a global tipping point an enormous opportunity for change. Dr. Lodog indicated to Maskell that the racial injustice evinced by George Floyd's death could spark a movement towards more care. She hoped that patients would demand care that focuses on wellness and healing beyond managing disease with more and more pharmaceuticals. In the context of the COVID-19 pandemic, Dr. Bland argued that functional medicine is uniquely positioned to focus on the immune system as a target for preventative medicine. Similarly, Dr. Fitzgerald wrote, functional medicine is well positioned to address the pandemic of chronic disease, thus reducing many of the risks associated with poor COVID-19 outcomes. As a result of functional medicine's distinct strengths, Dr. Gaudet indicated that although functional medicine has thus far been an adjunct or a garnish to conventional medicine, the COVID-19 pandemic could open the door to the widespread incorporation of functional medicine into the healthcare system. She opined that the conventional medicine paradigm is, quote, massively breaking down during the COVID-19 pandemic, allowing functional medicine practitioners to take the lead towards a massive breakthrough. Dr. Gaudet concluded that COVID has brought the future into the present and argued if there was ever a time for hope, it is now. Health is a matter of social justice. Ultimately, the key question of this presentation is, whose responsibility is it to ensure health? At stake are the nature of citizens' relationships to the state and the very issue of how we govern ourselves. In responding to this question, I call for collective action to denounce inequalities and advance the project of social justice in healthcare delivery. In so doing, I propose the term health justice, which I define as the struggle against racism, exploitation, and oppression taking place within the healthcare system by addressing inequalities' root causes, both with and beyond the healthcare system. My notion of health justice critiques deeply entrenched inequalities in conventional medicine. At the same time, health justice arises in response to the privilege and whiteness I have observed among functional medicine patients and providers, myself included. I argue health justice must ensure access to functional and preventative medicine in order to achieve its goals of economic sustainability and social equity. I have chosen health justice over healthcare justice, since in the same vein as functional medicine practitioners who contrast, quote, disease care with health creation, I am emphasizing the need for equitable access to the resources needed to create health, such as nutritious diet, safe housing, and clean environment. At stake is the distinction between health as a bioconsumer item that can be purchased through private markets versus health as a citizenship-based right and a public good. So I'm now going to show what I just received. It is the book cover for my forthcoming book, the first of the two, series of two, that is going to be available in the spring. And with that, I'm ready to turn over to question answers and field any questions you may have.
Oh, thank you, Dr. Vega. Everyone, a round of applause, virtual. Hey, can you do the stop sharing?
Yes. There.
Okay, I want to see all the virtual hands. Am I included here? Come on, y'all. Show some love. We're not giving her a stipend, so everybody, come on. Appreciate it. That was brilliant. Given that I got a D+ in high school biology, I was trying to catch up to you, and it was very challenging. So I just have a quick question, and I want everybody in the here to pose questions in the chat, and we'll try to get to them, and I'll pose them to Dr. Vega, and I'll kind of synthesize them. And also, there's an evaluation going on that's circulating by Justin, who's the visiting librarian here in ethnic studies. So I hope everybody fills it out. And it's also good for feedback for Dr. Vega and